Pharmacists are one of the most underutilized resources in healthcare. There is one on almost every corner, and yet they are not as active as they could be in caring for patients. My next guest is hoping to change that by freeing up pharmacists' time. I'm about to sit down with Eunice Wu. She's the CEO and founder of Asepha, a company that's doing a lot to automate the back end processes for pharmacists. I'm really looking forward to our conversation. Well, Eunice, welcome to the program.
Yeah, thank you so much for having me.
I'm excited to sit down because pharmacy and pharmacists are one of the most underutilized areas of healthcare, no matter what country you're in.
Mhm.
So I'm excited to talk to you a little bit about the company you founded and just in general, some pharmacy stuff.
Yeah, definitely. I'm really excited to be here. And I completely agree where pharmacists, they often say that we're the most accessible healthcare professional, but we're still not utilized as much as the other professionals.
Well, yeah, let's start there because one of the things that I think people maybe sometimes forget is that there is literally a pharmacy or a pharmacist
Yeah.
almost on every corner
Mhm.
of every street or every city in North America. And that is probably one of the most accessed points of healthcare.
Mhm.
But a lot of people don't realize that the pharmacist can do more than just giving you your prescriptions, right?
Yeah, I agree. I think whenever I'm at a tech conference like this one, I think most people perceive pharmacists as just counting medications, when really it's more so the pharmacy assistants who are doing the dispensing process. Additionally, there's various robots for automation that are currently doing that process. So we are alleviating some of those past roles, but we haven't alleviated the past misconceptions yet. Right now, pharmacists primarily are the best work that I enjoy is doing the clinical services and the patient-facing care. But I think a lot of patients don't really understand that that's something that they can get from a pharmacy until they actually experience it.
And I think that's one thing to point out is that it's not like the pharmacist is just sitting around doing nothing. They have like a lot of things they need to get done. But helping patients is one of the most rewarding parts of being in that role, I'm assuming, right?
Yeah, yes.
So, so let's go to that because I think that's kind of where your solution and the company that you founded is working on. Can you
Yeah.
tell us a little bit more about that?
Yeah, for sure. I co-founded a company called Asepha. We create AI tools for pharmacies, enabling pharmacists to do more with their time. My goal with the company is to enable pharmacists to eventually perform 100% patient-facing care. Right now, from my practice, I'm a pharmacist by training. Was spending 80% of my time on manual work that could be done by anyone without a pharmacy degree. And only 20% of my time was spent on actual clinical work that required my education and knowledge. And I found that this was very inefficient, especially with the global shortfall of healthcare workers, lower graduation rates, a lot more stress on the pharmacists due to new practice changes. And we really want to solve for this with Asepha.
And so, can you give us an example of some of the tasks that you're now able to help with through your AI tool?
Yeah, for sure. So something called medication reviews is when the pharmacist goes over the entire patient's list of medications. Typically, if you're on the younger side, not a lot of chronic conditions, you aren't eligible for this service. But for elderly patients or those with more complex conditions, there's some minimum criteria that you would meet for the service to be offered to you completely for free. This process takes up to 20 to 30 minutes in Canada, up to 45 minutes in the US as well. And what Asepha is able to do is we automate for the manual tasks, such as researching the condition, finding which recommendations would be better, identifying potential drug problems with the medication therapies that the patient is on, as well as doing all the documentation thereafter. So these three categories that I mentioned are things that you don't necessarily need a degree for. Anyone can be searching through PubMed, can be filling out a form, but what we really enable the pharmacists to do is focus on having that patient interaction, still communicating with that patient, having the conversation. And my goal with this is to not have the pharmacist having to document during the conversation, instead just being able to speak to the patient. And in real time, Asepha can actually identify new drug therapy problems that may come up during the consultation as well.
So, is Asepha supposed to be used just for the pharmacist, or does it also have a patient side component too, where the information that came up for the medications that they're on can be then given to the patient?
Yeah, so that's actually a common theme that we see in the industry right now. And I'm really glad you brought this up, where Asepha does have patient-facing materials, but it is initiated by the pharmacist. And that is something that's very important, where we need to have the clinician in the loop. There are some companies in the US that are creating solely patient-facing solutions using AI, that are autonomous. And this is a situation where it's very dangerous because AI is not at the level where it's ready to be used autonomously without that clinician in the loop. And that's something that we really optimize for. And a lot of our research is actually on the user experience and how do we create an interface or create a workflow that allows pharmacists to interact and double check every piece of information more seamlessly without having to sacrifice their time.
Right, you're talking about that having that trust.
Yeah.
The technology is enhancing the trust that
Yes.
the pharmacist already has established with the patient,
Yeah.
and it's not meant to replace the
Exactly.
pharmacist.
So, for example, if a patient was on too high dose of metformin, a diabetes medication, Asepha would never tell the pharmacist decrease the dose. Instead, Asepha would tell them, "Hey, the guideline says metformin, 2,000." I haven't practiced for a while.
That's okay.
2,500 milligrams is the maximum, but the patient is currently on 3,000 milligrams. So we've identified the actual dose and the supposed dose that they're supposed to be on, as well as the reference to it. And we would link them to the reference to American Diabetes Association or Canadian Diabetes Association. And then when you click into it, it has the inline citation and the highlighted component of the guideline so they can more easily check it within seconds instead of having to go to Google, type in Canada guidelines, scrolling through the document, finding where it is, and then going back to check the patient's dose.
What's the reaction been from pharmacists who have deployed your solution? What have they said about it? Has it really saved them a lot of time? Or is it really more that they feel that they're now a lot closer with their patients?
Yeah, for sure. I think it's mixed reactions. I think there's a lot of interest in the area. AI is a technology where I think a lot of pharmacists are excited about. And it's really interesting because in the past, you've seen technology come out, and even though it is ready to be adopted, it isn't adopted because there is that pushback from the healthcare system. For example, like AI recording and scribing has existed since 2018, but we haven't started implementing it until recently. I think there is a lot of interest, particularly in the documentation side, that would be the most heavily requested feature, just because it is a nuance to fill in repetitive information when you could easily just gather that information from the PMS. Like, why are we writing this information out when I've already written it in a different section of the patient profile?
Right. So you're talking about taking away the tasks that basically no one wants anyways,
Exactly,
right?
yeah.
We're not talking about clinical decision support or anything like that. It's just taking away these repetitive
Yeah.
administrative tasks.
I like to explain it like having a personal assistant in your pocket, but you don't have to hire a personal assistant. It's just Asepha, the technology.
And we were talking before we got on air, Asepha kind of attaches itself or integrates
Yes.
with existing systems. It's not meant to replace existing pharmacy system or an EHR or anything like
Yeah.
that. It works in conjunction. Is that right?
Yeah, that's correct. And that's why in Canada it's a bit more difficult to serve independents because they primarily operate with they primarily utilize a software provided by a bigger provider, in which case we would have to work with the bigger provider, which we are in talks with. It just takes a lot longer with the big organization. We more so focus on the larger chains who own their own software. But it's difficult because a lot of our interest is from independents because they have a lot of the pain points that we're trying to address. In the US is a bit simpler because a lot of the chains have their own software, even like the medium-sized chains. So it's a bit of a smoother process, but we do integrate in and essentially enhance the current system. I think something important with healthcare software is that you don't want to replace the current workflow. You want to push back against that. Pharmacists and clinicians are used to their way of practicing, and we don't want to steer them away from that. We just want to make it a lot easier.
So if you happen to be sitting in front of a pharmacist who may be a little bit hesitant about adopting AI or adopting AI to do what you just said, what would you say to them? What advice would you give to them?
I think AI won't replace clinicians or pharmacists. So if they choose not to use AI, I totally see why. There's a lot of hesitations there. I will say I think the clinician who uses AI will then replace the clinician that doesn't use AI. So it's not so much the technology that is the enemy that has the potential to replace these clinicians. It's more so the clinicians who are using AI and becoming like a clinician 2.0 with this service.
Okay. You've shared a lot of great information with us today. Where can people go to learn more about Asepha?
For sure. Our website is www.asepha.ai. That's ASEPHA.ai.
Excellent. Well, thank you so much for being on the program today. This has been excellent.
Thank you so much for having me.
Hey, I want to thank Eunice for coming on camera with me and giving me the lowdown of her Asepha product. It's very interesting and very cool what they're doing to help Pharmacists improve their back-end processes so that they have more time to potentially spend with their patients and helping them guide them through their care after they've been to a doctor for a visit. And hey, if you enjoyed this interview as much as I enjoyed being part of it, please like and subscribe. Also, head on over to healthcareittoday.com for more great content like this. I'm Colin Hung here in Toronto, Ontario. Thanks for being here, and I'll catch you on the next video.